So this exercise is called Shrugs, and what you're going to have the patient do is just bring their shoulders up like this, hold it for 10 seconds, and then they can bring it down, and they'll do that 10 times. You want to make sure they're not really bringing your shoulders forward at all, just kind of up like that. All right, this is called the rope IR stretch, and there are 3 phases. The first one, they'll take the rope in their affected arm's hand, and they'll just use the other one to kind of pull their arm back like this as far as they can, and they'll hold it for 10 seconds, 10 times. The second phase, they'll put their arm behind their back like this and use their other hand to push it away from their back until they feel a stretch, like this, and they'll hold it for 10 seconds, 10 times again. And then the third phase, they'll have the rope over their opposite shoulder of their affected arm, and they'll use it to pull their arm up like this until they feel a stretch. And again, this is 10 seconds, 10 times. So this one's called wall slides or crawls. And what you'll do, there's 2 directions. There's flexion, where you just kind of slide or crawl up the wall like this until they feel a stretch in their shoulder, holding it for 10 seconds, 10 times. There's also abduction, where they're coming to the side, same thing, just going up until they feel a stretch, holding it for 10 seconds, 10 times.
This next exercise is called supine cane, active assisted range of motion, flexion, and abduction. So you'll have the patient lay down on the table and hand them a cane. They will use the cane and lift as far up as they can into flexion, and then come back down. They'll do this exercise for 10 times and hold it at the top for 10 seconds. They're using their unaffected arm to help assist pulling their arm up and down and try to get a good stretch. So this is the flexion direction, and then they can also do it in abduction by helping lift using their unaffected arm. Again, holding 10 seconds at the top and coming back down. This exercise is called pendulums. So you'll want the patient to get a staggered stance with their opposite foot of their affected shoulder forward, and have them take a tripod pose on, say, a table or a chair that's next to them, and they're going to use their body to swing their shoulder. A common mistake that a lot of patients make is they'll keep their body still and just move their arm in circles, and that's not what we're looking for. We're wanting their shoulder to be completely relaxed and using the momentum of their body to swing it back and forth in circles. We'll do that 3 times for 30 to 60 seconds. This exercise is called shoulder flexion. So you'll grab the bands for their shoulders and have them face away from the bands, slipping the hands through the holes. And they'll lift their shoulders up to about shoulder height, making sure that their thumbs are facing up and back down. They'll do 3 sets of 15 of these. There's also a modification where they can use a weight, again keeping the thumb up and lifting their shoulder, their arm straight up, doing 3 sets of 15 of those. And if the therapist wants there to be a lower anchor, they will specify on the chart.
All right, this exercise is called shoulder abduction, and what you're going to have them do is loop their hand through the loop in this band with their thumb up, and they're just going to bring it out to the side like this until they get about shoulder height, and just go up and down 3 sets of 15. Another way they can do it is just with a weight in their hand, and they'll have their thumb up again and just go out to the side 3 sets of 15. This next one is horizontal abduction, and what you'll do is you'll take the band in your hand like this, and you'll just go out to the side like this, keeping your arm at that shoulder height, just going out to the side 3 sets of 15. All right, this one is horizontal adduction, and with that you'll put your arm through the loop, your hand through the loop in this band, and you'll just go across this direction 3 sets of 15, keeping your arm at shoulder height.
This next exercise is called a tricep press. So we can do that on either the bands or a weight. So we'll have them face away from the bands and making sure that their elbow is staying connected to their hip, press down, and do 3 sets of 15. They can also use a weight machine, and again, keeping the elbow connected to the hip, press down, do 3 sets of 15. This exercise is a bicep curl. So you will take one of the dumbbell weights, hand it to them, and making sure that their elbow is staying connected to their hip, just lift up into a bicep curl, and they'll do 3 sets of 15 of that. So this next exercise is called the Serratus Press. You're going to take this bar It's just hidden underneath that table, and you will insert it into this machine. You want it to be angled upward so that the patients can have their arms completely straight. Then the patient will lay down and grab onto the bars, making sure that it's high enough for their arms to be completely locked out. And then they will push out and come back down with their shoulders and do 3 sets of 15 of those. This bar is too high. You can adjust it by pulling out this little trigger and making sure to support underneath and lowering it up or down. One of the biggest mistakes with this exercise is if their elbows bend during the exercise. In that case, we want to remind them to lock out their elbows because this is not a bench press. We don't want them bending their elbows and straightening it. It's just a serratus, and they should feel it in the back of their shoulder.
All right, this is called push-up plus, and what you'll have the patient do is just kind of put their hands on a counter or table, and they'll keep their arms locked, and they're just going to kind of push down so that their shoulder blades are going together, sort of like with a scap set feeling, and then they'll push back up, and they'll do 3 sets of 15, and it's really important to make sure that the patient's not bending their elbows at all, because then it's just a normal push-up and it's working different muscles. Right. So for the push-up plus exercise, when you're watching the patient, their shoulder blades should kind of be coming together when they're going down into the push-up, kind of like in a scap set, so the shoulder blades are kind of trying to touch, and then when they push back up, they'll come back out this way. So that's what you can look for when they're doing it to make sure they're doing it correctly. All right, this exercise is called wall ball taps. And there's 2 different ways to do it. The standard way is just having them come up and kind of bouncing it against the wall like this for 30 seconds. And they just go back and forth like that. And then the other way is arcs. And they can do it coming out to the side like this. 3 times for 30 seconds, just back and forth on the wall like that. When they're doing the arcs, they should start from straight up and do their best to get to about 90 degrees like this, and just going back and forth while tapping against the wall. So these exercises are all named after letters in the alphabet. There's T's, W's, I's, and Y's. And a lot of times we'll have the patient kind of on the corner of their table, and they'll have weights in their hands. And so Y's is bringing it out like this, just up and down, 3 sets of 15. T's are bringing it out to the side, 3 sets of 15. And I's is having them together like this in front of them, 3 sets of 15. And then W's, they'll bend their elbows and bring them up and do 3 sets of 15. A lot of times we'll have them do it on the table. Other times we'll have them on a yoga ball, just kind of laying on it, and they'll hook their feet on the edge of the table so that they don't roll around everywhere. And we also will have the patients do these exercises with one of these bands. So there's Y's, just going to the sides like this. There's T's, like this. And then I's, they can do like this. And W's like this, making a W with their arms.
This next exercise is called shoulder. Oh my gosh.
And what you're gonna do is have the patient put their hand through the loop of this band, and they're gonna, let's see if I can do it this way. Okay.
And one of the biggest
Just keep going.